This is one of the biggest myths in our whole healthcare debate. It is true that if you break your leg or if you have a heart attack or if you have a stroke, you can go to the emergency department and they will take care of you. Absolutely true. The problem is that in the U.S., the major problems are not these kind of immediate issues, but rather they're chronic diseases which people have for their lifetimes. The problem is that uninsured people can't afford to see physicians on an ongoing basis, and they can't afford to take their medication. They're also less likely to get preventive care to manage their chronic problems. So they wind up getting much sicker. They actually have a stroke or a heart attack because of their high blood pressure that was out of control, and that's when they need to go to the emergency room. So yes, the emergency room will take care of them then, but that's absolutely not the way that we should take care of people in the U.S. Well, it'll mean a lot. First of all, what it's going to mean is that they have financial protection, which is very important. So if you look at people who don't have insurance, who then get insurance, they're much more likely to get to see preventive care. They're also much more likely to have an ongoing relationship with a physician who's located in an office or a health center rather than in the emergency room. So if you just think about things like when they get into care or the kind of care they receive, let's use for an example women with breast cancer who either have or don't have insurance. Women with breast cancer who have insurance are much likely to get detected earlier, come in earlier for treatment, and basically are much more likely to be treated well than people who don't have insurance. People who don't have insurance are much more likely to come in late, to delay care. Maybe they didn't get their preventive treatment. The whole issue of having a health insurance card does not mean that you're going to have access to health care. So if you have a card, you need to be able to find a physician who's able to treat you and who's willing to take you on as a new patient. And if we don't have enough primary care physicians, this is going to be a serious problem. Now, what we mean by primary care physicians are physicians who can take, you go to for first contact when you feel ill. It's very important to understand that in the United States, we do not have an adequate supply of primary care physicians. In other countries where they provide effective health care, they have about 50%, about half of their doctors are in primary care, whereas in the United States, it's only about a third. So what that means is that people are going to have a hard time finding a physician. If we get 46 million more people covered, they're going to have a hard time finding a primary care physician in many parts of the country. So we need to provide some kind of incentive for physicians to practice primary care, and then we need to do other things to make the organization of practices more efficient, such as using electronic medical records and group practices so that physicians have an easier time working. And then I think we need to increase the pay of primary care so that they're willing to stay in that field.